hey, where am I with my symptoms, with my struggles? Where would I like to be? And how do I bridge this gap? And sometimes bridging the gap is also learning to prioritize yourself and self-care. As I said, an ideal 24 hours would be 8 hours sleep, 8 hours play, 8 hours work. We don't live that way. Many of us don't add ourselves as a VIP in our lives, a very important person. We make everything more important, of how we all have negative thoughts that we have to overcome. The problem is we hold on to yesterday's story into today's world versus allowing ourselves to live in the here and now. Everybody meditates. We just don't realize meditation is when you're doing one thing with complete presence.
Dr. Monica Vermani, thank you so much for coming on the podcast.
Thank you, Brandon, for having me.
We're going to talk about your book. It's called A Deeper Wellness, Conquering Stress, Mood, Anxiety, and Traumas. This book is great. There's a lot of great resources in it. I had a chance to read it. You're also I know you're helping at the individual level, but you're getting into a lot of corporate wellness. And I'm hearing in my circles and in the people I talk to on this podcast as well, my HR friends, this is a big issue for a lot of HR professionals and leaders of organizations. People are struggling with stress and burnout and anxiety and all of those things. And how did you get into corporate wellness in the first place?
So I'm seen as an expert with mood, anxiety, and trauma populations. I started my career working in correctional facilities with women in prison, men in prison, Center for Addiction and Mental Health, a hospital just with anxiety disorders, UHN with brain and spinal cord injury, military 9/11 work. I've done a lot of work with extreme populations with trauma, mood, high stress, and anxiety. And, a lot of my individual patients that come to private practice have encompassed also executive level. And a lot of them are in high stress, high pressure during the pandemic. A lot of executive level or management level were really feeling pressed. There were first responders that were working triple the amount. And there were a lot of people who were out of a job during that time. So during environments where there's high levels of uncertainty and stress, people have more symptoms. All symptoms have a purpose. And the first step to treatment is awareness. And a lot of my patients were still grounded and healthy because they're working on themselves throughout the pandemic. And many of my executive level or corporate owners started saying, hey, would you come into my workplaces and start bringing in some health and well-being? There's a lot of toxicity. There's a lot of people having struggles with communication or mood, anxiety, and stress traumas. And by starting off with a couple of small companies, my corporate wellness start living programs have grown. The book came out, A Deeper Wellness, which is, a nice way for people to work at wherever you're at to work through stress, mood, anxiety, and trauma that bubbles up to the surface. Many of us push things aside. We need to address them to make things better. And as I've been doing more corporate wellness, my intention is to just help provide healing to greater and greater numbers. The first step to treatment is awareness, and having awareness from a doctor who works with it every day brings not only clinical diagnoses, treatment options, resources out there, but it helps you understand day to day what your symptoms are doing for you, how they're helping, how they're hurting. And not only you, your family members. When you're in pain, you spill over onto others. When you're in a place of health, you also have a ripple effect. I did HR.com this year as a keynote speaker. And, a lot of human resources, a lot of workplaces are finding mood, anxiety, disability, short-term leaves as a problem post-pandemic. And I'm on their mental health advisory board, and we're always speaking about how to bring in mental health resources so that people are not just physically fit, we're mentally fit too.
Monica, we'll get into the details of your book because there's a lot of good stuff that I want to make sure that listeners are hearing. But just on the corporate wellness side, as you've got into this work, I'm curious what role the companies are playing in their people's well-being. I'm like, this can't be their full responsibility, but helping maybe bring awareness to this issue and even just facilitating that. Is that the role they're playing, or is it something else?
So what we're finding is companies usually do the check mark to have the basics in place. They have their EAP programs, their employee assistance programs, and they have benefits so that people can try to get some support if they're struggling. But what's happening is people don't know how to use it. They don't know what resources to ask for. There's so many different types of professionals out there. There's psychiatrists, there's psychologists, there's social workers, there's psychotherapists, there's coaches. People don't know necessarily where to go for assessment, diagnosis, treatment, or to understand who treats ADD, who treats anxiety disorders, who treats trauma. And one reason why resources are not being used by employees, they don't understand these things. HR departments know a lot, but they're that one point of reference that people come to when they're in crises. And those people are overstretched, and they're also that middle person. They're between you as an employee and the executive levels and management. Sometimes they're telling management certain things that are not being implemented as solutions. And so what's happening is people are going beyond the benefits, going beyond just the basics of what they bring in for wellness as talks, to now bring in maybe psychologists or other people to really help facilitate healing by helping people understand, hey, you're struggling. Instead of taking a sick leave, let's look at, resources and people that may benefit you as you're working through your issues. So a lot of what I've, found successful in corporate wellness is I do my lunch and learn talks about awareness and understanding symptoms, which I have a little board here I can show even to the audience here. Any problem in life you can put on this table, and it will manifest and show up in your life in 3 distinct ways: through physical or physiological symptoms, headaches, muscle aches, abdominal distress, constipation, panic attacks, heart palpitations, fatigue, the list goes on. Negative thoughts of you, your world, your capabilities, imposter syndrome, not feeling good enough, not feeling capable, comparing yourself to others, feeling like a failure. And the third way is behaviorally, lifestyle habits. So you've got physical symptoms in your body that are bothering you. You've got negative thoughts racing in your head. What does it look like in your life? Eating too much, eating too little, sleeping too much, sleeping too little, avoidance, denial, procrastination, feeling exhausted every day, drinking alcohol, porn addictions, video gaming, addiction to technology, staying in abusive relationships or not asking for help at your workplace. My goal as a therapist is to teach you how to understand your symptoms, to then also break the legs, whether it's medication you use or meditation. Meditation teaches you how to sit with symptoms, working on negative thoughts that hold you back from believing in yourself and being your highest and best version of you. And behaviorally, what are lifestyle habits that are unhealthy that you've attached yourself to that you maybe need to get rid of in order to live a healthier lifestyle? So a lot of my goal is teaching people to understand the purpose of their suffering, the purpose of their symptoms. And then in corporate wellness arenas, I've offered something called office hours. As a doctor who clinically treats and assesses, I'm able to sit down with you and you can share a little bit of what's going on in your life that you want guidance from. And I can tell you what resources would be useful as a book, self-help, therapist, or a doctor, that what you need to ask your GP or family doctor for to really target the symptoms that you're sharing with me that are problematic in your life. If we don't take charge, we do the best we can with what we know. What we know sometimes just keeps us on that hamster on the wheel. We don't shift enough.
Right.
Bringing in awareness and knowledge. And that's where I come in. Sometimes companies are bringing in a face-to-face, personable approach to understanding wellness. And so instead of just calling an EAP or a phone number, you're now meeting a person who talks you through, these are the steps to your wellness. These are the steps that you can pursue for your child's wellness or your partner's wellness, or intervene if you're having issues at home. Because remember, when you're in pain, you're spilling over onto others, your family members, your loved ones, your workplaces. And many of us feel guilt, shame, blame about that. Let's take charge. And workplaces are powerful places. 1/3 of your day you're at work. You got 8 hours work, 8 hours play, 8 hours sleep is an ideal day. 1/3 of your day is at work. If we're not taking care of our health, we're impacting that area quite significant.
Yeah, awareness and understanding seems to be the biggest hurdle. And in the introduction for your book, you'd mentioned an elderly gentleman whose doctor missed the connection between like physical symptoms and mental health issues that he was currently experiencing. So how common is this in today, where we go to a healthcare professional, list all these symptoms, and they mistake it for physical versus like there's truly something rooted like mentally or something else that's causing it?
Brandon, very few people know this, but this is my second book, not my first. My first book is my thesis, my doctoral thesis that got published into a book, and that's called Primary Care Mood and Anxiety Diagnoser. I was blessed to have a huge project as my doctoral thesis to show that in family physicians' offices, which is the first line of treatment people go to, that we're missing psychological conditions and we're attributing a lot to physical. So back to this chart I gave you, most people when the symptoms physically are louder and louder and bothersome in your body, we just want to get them down. So we go first to our doctor. We're not sharing the mindset and the rumination and the low self-esteem, and we're not sharing sometimes the unhealthy habits we do to self-medicate. So on a physical front, we go to our family doctor when we're having panic attacks, when our anxiety is really high, when our mind is racing, when we can't sleep, we can't eat. So first line of treatment is your family physician's offices. But remember, when I did my thesis, I had an elderly gentleman say to me, back in my day, we'd sit with the doctor, we'd chat with them about our life, and then they'd take us into the physical exam room, examine us, and then we leave. Because now I go straight into the exam room. I have 10 minutes to share everything. Ugh. And then they put me out, and it's so rushed. I don't feel like they get an accurate picture of what's happening in my life. That made me do my thesis, where I sat in family physicians' offices and I did psychiatric interviews for people to get some payment. They gave me time and energy, and I did psychiatric interviews, and then I got to compare physicians' charts to see if they caught any of the psychiatric things I caught from my 1 hour interview with their patient. And then I got to share with the doctor, hey, what you're seeing as like high blood pressure and all these physical symptoms, and you keep sending them for labs, this person meets criteria for generalized anxiety disorder. This person meets criteria for trauma. Have you ever spoken to them about abusive childhoods or the problem they're having at work right now? So what's nice is my thesis showed over 50% of the people I examined out of 953 subjects, over 50% were not caught to have certain psychological conditions for their physical symptoms. So a lot of family doctors are prescribing and overusing medical system, labs and tests to look for physical reasons and medical reasons for psychological mental health concerns. And something I was blessed to do back in the day, we had physical files more than electronic ones. And I used to weigh physical charts because there was literature out there that suggests that the heavier your chart, the more likely you had psychological mental health issues. And I showed that with, my thesis, because back in the day we were able to weigh the charts. People who had the most labs, requisitions, most examinations usually had a mental health condition of mood and anxiety disorders, and it was not caught or constantly not treated appropriately. Many of us are not realizing that our physical symptoms are many times a manifestation of psychological underlies and psychological conditions of like anxiety, depression, or other traumas that are going on that are not detected.
That leads me to believe that either there's like a lot of things swirling in my head. It's like either our general doctors aren't trained or the system's not set up to appropriately like spend enough time with each of the patients, and people don't have the tools to recognize these as well, or they just don't have the healthcare professionals at their fingertips for psychological.
So I don't blame them.
Yeah.
You have to remember GPs are physicians who know a little bit about everything.
Right.
And you go into their office as a first line of treatment. Any healthy professional will realize they can't do it all. And that if something's a gap, they need to refer out. They need to bring in specialists for psychiatry or mental health or psychologists. But realize, we do the best we can with what we know. Us clinicians are only as good as you allow us to be. The first step to treatment is awareness. A lot of my work in corporate or even with my book is to teach you to advocate for yourself, you to understand your symptoms so that if you communicate it well, the person is more likely to pick up the gaps so they can treat you properly and give you the right lines of treatment and resources that would benefit you. Sometimes the problem is not the clinician you go to, it's the fact that we're not communicating our symptoms right. Because think about it, that table I showed you, mind, racing, physiological symptoms, getting overwhelmed with bad behaviors and maybe alcohol or drugs, numbing things. We're not accurately seeing our own symptoms. And sometimes you're so overwhelmed by what's going on, you don't know how to speak about it. And so, there's some doctors like me who is great at pulling information out of you, but some people wait for you to just hold you in compassion, say, tell me what's going on. And if you're not good at clearly explaining your symptoms, and a good way to do that is literally break it down.
Right.
What are my physical symptoms, negative thoughts, negative behaviors? Then the doctor can say, what are treatments for this, treatments for this, treatments for this to help this shift?
Yep.
And so we need to be better advocates for ourselves
Right.
so that we can advocate to tell the doctor what we think we need. And then the doctor chimes in with their talent to say, hey, this is what I think too.
Yeah.
It's a collaborative effort.
For the benefit of the listeners who are just listening to the audio only, Monica was holding up a three-legged table, which is the emphasis of chapter 1, which is just bringing awareness to the areas of the problems that we have that are on the surface of the table. So go check out the chapter 1 that's got a lot of good stuff on the self-awareness piece. In chapters 2, you start diving into like, what can we do as individuals for self-care? And you talk about envisioning your ideal self. So how can we use this exercise to help us achieve personal and professional goals?
So as I mentioned, you live day to day with physiological symptoms, negative thoughts racing in your head, and negative behaviors, sometimes like not eating well, not sleeping well, procrastinating. We live with all these things intermingled. How do we actually know where we want to go in life when you're not happy and fulfilled? It's about looking at where am I and where would I like to go? So I always tell people, if I had a magic wand, I can take away your problems. Where would you like life to go? My goal as a therapist is to take you from where you are to where you want to go. This gap are your symptoms. And so understanding, people need to realize, okay, where am I with my symptoms, with my struggles, with my happiness, with my own life and happiness with people and things around me? And where would I like to be? And how do I bridge this gap? And sometimes bridging the gap is also learning to prioritize yourself and self-care. Mm-hmm. Many of us are raised in a society where we put everything ahead of ourselves. And I always say there's a quote, being well adjusted to a sick society is unhealthy. And, I call it a sick society because we have so much competition. We have so much, comparison to others, overworking, not eating well, not taking care of ourselves, sometimes putting others ahead of ourselves with people pleasing. It is important for us to recognize what are things that my parents have taught me that are not always healthy, but they modeled that behavior to me about anxiety, about overworking, about sacrifice, that maybe I need to reconceptualize from my own life to bridge this gap between where I am and where I want to be. Sometimes where you want to be is in a place of health. Well, don't give from an empty well, give from an overflow. Learn to take care of your reserves of energy. And stress is when your activity level surpasses your energy level. Activity is mental and physical. So you can only bring it down so much. You have things to do. The other option is to bring up energy levels. The 4 sources of energy we have is plain and simple, the basics, the food we eat. Many times we're not eating for nutrition. We're eating to spike our sugar levels because we need more energy with caffeine or sugar, or we're bringing it down at the end of the day with alcohol or smoking to take the edge off and numb things that bother us or the worries that go on in our mind. Are you eating with a steady flow of nutrition throughout the day, or you're spiking up and down with sugar, caffeine, carbs, and this and that? Second one is sleep. Are we prioritizing sleep? As I said, an ideal 24 hours would be 8 hours sleep, 8 hours play, 8 hours work. We don't live that way, but learning to prioritize sleep, because 1/3 of my day should be prioritizing the wear and tear I go through, how to replenish it, how to renew it. Your muscles, your nervous system. Are you giving yourself enough time that during REM sleep, deep sleep at night, that you are actually replenishing, renewing, and allowing yourself to wake up in the morning renewed and refreshed? And if you're not, what are the reasons for it? Sleep apnea. Alcohol that you're drinking is a depressant. It might knock you out, but it doesn't give you quality sleep. Looking at things like eating before bed or watching too many stimulation on TV that you're not able to fall back asleep at a decent time right when you go to bed. Third one is exercise and breathing. As children, we breathe from our belly. And as we get older, we do short and shallow running around, racing around in the day. Are you able to exercise and breathe and bring down your airways so that you're feeling more relaxed in your body, your mind is clearer, and you feel on top of your game? Or are you racing through the day, always behind that clock and always behind that to-do list? And the fourth one is a calm state of mind, dealing with things. Deal with your marital problems, deal with your personal issues with yourself, your self-esteem issues, bad habits, procrastination, addictions. Learn to start facing the things that you did once to take the edge off that maybe are causing more detriment to your life, causing problems with communicating with your partner or your friends, reaching out for help. Learn to take charge of the energy in your space by aligning yourself with supports that lift you and keep you stuck, and keep repeating that hamster on the wheel pattern of feeling exhausted in life. Learning to understand taking care of ourselves is how we make the world a better place. You want a good world out there? Start with you. As you take care of you, you role model to loved ones around you and your children, your family members, healthy habits, and then you also model it to workplaces and people that respect you as a character. That makes the world a better place because there is a ripple effect where people model the behaviors that they look at you with admiration of, to say, hey, my boat's kind of sinking. Let me jump onto this person's boat. They seem like they're doing things that are working in alignment to their health.
In chapter 5, you explore the purpose of suffering, which is hard for anybody to deal with traumas and suffering, especially when we're in it. It could be really dark. How can understanding and finding purpose in suffering to help individuals, leaders, HR people foster resilience within themselves and their teams?
I love the topic of suffering. I've started my career in working in such extremes that I saw extreme versions of suffering. And I realized one quick observation: all human behavior has a purpose. All human suffering has a purpose. Our suffering, everybody's got it. It's a fabric of life. We all have good, bad, the ugly. We're all perfect and a work in progress. Suffering is, the purpose of it is to bring about a catalyst for change. And to whether that change is you going outside yourself to seek help, you go within yourself to really face your demons and face what you're avoiding or not dealing with or processing. Suffering has its place for your growth. It's about us recognizing, not getting caught up in the story of suffering, but looking at the symptoms and what is being mirrored back to me. And I use that word mirror because in your suffering, you are mirrored back to you, your resilience, your strength, your weaknesses, your insecurities, your comparisons of how you're not feeling good enough. You recognize in the mirror of your suffering the self-depreciating thoughts you live with every day, the standards you hold yourself to, perfectionism, how you worry, and how you maybe live your life not in alliance to you being a priority in your own life. Many of us don't add ourselves as a VIP in our lives, a very important person. We make everything more important. And if you get caught up in the story that is teaching you lessons for your health, it will lead you to your demise because you can get stuck in an anxious loop.
Mm-hmm.
Now, don't get me wrong. I've worked with people with extreme traumas, and I would never wish the horrible things that I've seen people go through. But I know one thing: regardless of what you go through, people end up seeing sometimes the strength that they never thought imaginable in their lives because of the horrible things they went through. And no matter what situation you're left with due to the circumstances that were painful, you can find a reinvention of yourself. Whether you go downhill with it or reinvent yourself in a new way is going to be about you and your coping skills and how you help yourself. I've had people, and if you listen to my TED Talk, which is Thoughts Are Powerful Things, it's think about it, good or bad, anything that's ever been created in life started with a thought. In my TED Talk, I talk about good or bad thoughts shape our lives. And in that TED Talk, I share at the end 3 patient stories with their consent and my own story of how we all have negative thoughts that we have to overcome, challenge, revise, reconceptualize to be who we are today. And even who I am came from me challenging my own thoughts. But in those stories I shared people who were, quadriplegics who reinvented their lives. I shared one with a mute comedian today who's up on stand-up comedy everywhere in the world. Like, it's fascinating for me to see that when we change our negative dialogue on the inside, that even if you have circumstances every day that are troublesome, like being mute or disabled or having, pain and suffering due to physical pain and other losses in your life, you can still reconceptualize your life and restart it with a new outlook. The problem is we hold on to yesterday's story into today's world versus allowing ourselves to live in the here and now. And a part of alleviating symptoms and working on a deeper wellness is really about giving yourself permission to let go of what you're attached to. The 2 reasons we suffer: we don't accept people, including ourselves, as we are, and we don't accept situations as they are. I might not be able to change your situation, but you can reconceptualize the way you see yourself and see the good amongst the bad each and every day. Many of us choose to stay stuck in scrutiny, judgment, criticism. We are so hard on ourselves in today's world. And we don't know how to give ourselves permission to get out of that loop. And so suffering, everybody's got it. It's the fabric of life.
Yeah.
But the extent of the pain and suffering that it affects you can come from how you bring in the tools to help you self-soothe, manage, and reconceptualize life. I can't take away what's happened to you, but you can definitely build tools and resources and techniques in your life to bring joy. Like I have a patient right now who she said to me, you once said to me, Monica, that if I bring others joy, I'll find it for myself. And as much as I was hating my life day to day, she works at a pet shelter, and she goes, bringing these, rescue cats joy brings me joy. And she goes, I feel purpose now, even though I have all these other chronic pain issues, trying to help others brings me joy. And I get it now. What you were trying to tell me is go beyond me and my pain and suffering to do something outside of me. And that's just one story. And I'm not saying this applies to everybody, but we do need to brainstorm of what are things that are keeping me stuck and not seeing the beauty amongst the chaos in my life.
Right. And seeing the beauty is also about being present, and meditation can help that. You emphasize the importance of it. And I think a lot of people, they don't meditate because for whatever reason, they're busy. They think it's overwhelming because they don't know how to do it. It's too woo-woo, whatever it may be. But what are some simple ways that we can meditate so we can bring it back to the present?
So plain and simple, we all meditate, whether you think it or not, as woo-woo, hippy-dippy, you want to call it. Plain and simple, each and every one of you who are listening to this, and anybody who's not listening to it, everybody meditates. We just don't realize meditation is when you're doing one thing with complete presence. That's it. When you're doing one thing with complete presence, where you're focused in the present time, you're experiencing, doing, and acting. And you're out of your head and you're just in that place called the zone. So when you have that moment where you're like hanging out with friends and you're like, oh my God, 4 hours passed by. How did that happen? You were in a place of meditation. You did one thing with complete presence and you were in the zone, we call it. You lose the concept of time and space. You're playing sports and like the whole hour goes by and the game's over, or you're following that ball through the whole game, that you lose the concept of where you are in time and space. That's meditating. When photographers call it the pocket, where again, you're focused on one thing with complete presence. Each and every one of us have experienced a moment where you lose the concept of time and space and are connected to your senses, meaning smell, taste, hearing, touch. When you're in a place where you're just experiencing, doing, and acting, you are meditating. You are in the moment. And the fastest way to get there is by doing something. When you're in your head, for example, your mind goes to two places. It goes to the past and compares yourself to, memories and regrets, past hurts, and compares like, what if that happens again to me? Or your mind goes to the future, and future is imagination. We often imagine worst case scenarios than best case scenarios. So we're forecasting worst case scenarios. We're catastrophizing. We're worried about what if this happens? What if that happens? Anxiety and depression is a thought disorder. It exists when you're jumping around back and forth to the past and the future. Bringing yourself to the here and now is about being present. And the one thing that can do that very fast when you're stuck in that anxious loop in your head, overthinking things, is your breath. And the breath allows you to come back to the one thing that goes moment to moment. Your breathing is the only thing that goes moment to moment. So as I inhale and I focus on what it feels like as a warm air comes through my nostrils, fills up my lungs. What does it feel like? My belly expands. And then when I exhale, the cool, the warm air leaving my body, the cool air coming in. Like learning to follow your breath can be the fastest way to get out of your head and stop thinking about the things that are causing you distress or making you physiologically stress up and tense up or get anxious or have heart palpitations. We need to realize that your mind body has a connection, and a lot of us live over time in our head, and we don't allow us to be here and now, breathe, connect, trust. And enjoy something. So again, if I made banana bread, it smells good, tastes good, it's perfect in this moment. Then I go, oh man, last time I did something this, that made it taste better. I'm comparing it to another time. Then I go, next time I got to do this, this, and this to it. Now I'm taking away from my present moment to try to control it to be better for the next time. How many times do we jump around comparing, judging, scrutinizing, criticizing versus just being in the moment and just enjoying something exactly as it is? I am who I am and I am enough. We don't need to be so hard on ourselves. And meditation, we all do. But yes, there are wonderful forms of centers and places and teachers out there and books and resources that teach you how to get out of your head, connect to your body, allow your breathing to be aligned, do a stretch, do a yoga practice, go do physio, massage, get, running. Many people with ADD or high attention, or their mind's always jumping around with anxiety and stuff, need an active meditation. And some people like to just sit in silence all day like I do. Pure and simple, it's about you looking at the menu list of all the things I can do one thing with a complete presence with, that brings me joy, that makes me feel good, and making it a priority to do it every day. Doing it once a day is just a start. Then the goal is weaving it throughout your day, bringing in mindful moments where you connect, as simple as rotating a meditation wheel, doing a chant throughout the day in between sessions, giving yourself a moment for a mindful moment to eat a treat, have a healthy snack. Give yourself permission to drink water with that awareness of refreshing and quenching thirst, as well as hydrating your body and having compassion at the end of a long day to say, thank you, thank you, thank you for a beautiful day, and giving yourself a moment of praise, looking at how far you've come versus always looking at all the things you haven't done. Gratitude is a meditation, focusing on one thing, of looking at all the wonderful things you're grateful for and all the wonderful things you maybe did in that day. The way I like to do gratitude logs is I remind people to just reflect on the day. At the end of the day, take a little journal and reflect on the day. What brought me joy and what am I grateful for? I'm grateful for, the orange that was put in my lunch bag this morning. I'm grateful for having this podcast to talk to all these wonderful HR people to realize that health and wellness is something we do have to bring into our corporations, because we're in a lot of toxic environments where people feel alone, separated. Bringing in tools like teaching meditation, bringing in doctors like me to do office hours so that people anonymously can sign up and get guidance so they can use the benefit versus just saying we have a benefits program. That's great, but many people don't know how to use it properly or get discouraged by not getting the right therapist the first time round. Learn to bring in things that might help our people be healthier in a corporation, for the whole corporation to be healthier, which increases productivity and also increases morale for talent to stay at a good company.
Many HR professionals are talking about we need to have our people bring their authentic selves to work. And what advice would you give to leaders and anybody, any individual contributor listening to this, who are just maybe struggling with balancing their authenticity with the demands and expectations within their job?
Authenticity comes with health. And so you have to have, like I mentioned earlier, stress is when your activity level surpasses your energy level. Bridging the gap of the stress that you carry within your body or in your mind will allow you to also be in a state where you can respond versus react. Many of us are so reactive, irritable, personalizing things, cutting people off, feeling like I already know what you're going to say before you say it. We're just not in good states. We're just not in good state of minds. And so we're in a place where we have to rush everything and we were just moving ahead. Where are we moving to? We're all going to die at one point. What are you rushing for? Slow down, pause and reflect, get comfortable with uncertainty, and do unto others as you want done to you. Hold people in love and compassion. Treat people the way you want to be treated, and recognize that I must be stressed out if I'm not breathing, if I'm not, pacing myself, if I'm not able to really be mindful and hold somebody in the right space, if I feel like I'm rushed and I'm always behind that to-do list. Learn to start understanding what priorities are. Learn how to bring in resources that teach you to be mindful, teach you to get out of your head, to teach you to understand your symptoms of how to manage them better. You know, in today's world, authenticity first starts with physical and mental health. And the more you're healthier, the more you're able to tolerate and hold people in a space of love, compassion, and understanding. Otherwise, we're reactive, frustrated, irritated by anybody who's different from us. And post-pandemic, it increased. People found themselves more irritated by people and finding themselves having less tolerance and cutting people out at the first sign of anything that was done with hurt, harm, or threat. Learn to take a step back, consolidate your thoughts, figure out what you need to do to be a better version of you. And then, you know, you want to try to live in alliance to how you want to be remembered at the end of the day. How do you want people to see you? How do you want people to remember you? And are you trying to live a day-to-day authentic life that aligns with how people that you care about would remember you as kind, as nurturing, as, you know, a good mentor, as supportive, as loving, as healthy? Are you living so that you're proud of your life?
Monica, great discussion. Love the book. Your book is called A Deeper Wellness, Conquering Stress, Mood, Anxiety, and Traumas. We'll put links to we'll put a link to the TED Talk, the book, all that stuff in the show notes. Any just last word or anything you want to point people to before we leave?
Don't give from your well, give from your overflow. Remember, a lot of us are giving from empty wells today. Learn to recognize that no matter how busy you are taking care of others, you got to take care of you first in order to role model to the people you care about what health is, and also to bring about the changes in your relationships, in your friendships, in your world, in your productivity, in your workplaces. If you're not healthy, everything around you has an unhealthy ripple effect. Being healthy is choosing to be a VIP, very important person to yourself. Add yourself into the equation of your life. Stop existing, start living. Please try to work on yourself. We are here literally for an individual journey amongst a collective. If you don't put yourself into the equation of your life, you will have mood and anxiety and other symptoms popping up as a reminder to take you back to what matters, you. Don't get caught up in the stress load. Understand the purpose of the symptom and realize you matter.
My guest today has been Dr. Monica Vermani, the author of A Deeper Wellness, Conquering Stress, Mood, Anxiety, and Traumas. Monica, thanks for coming on.
Thank you very much for having me.